to explore the framework that defines privacy in American healthcare, which is the history of HIPAA. While we often think of HIPAA as just the form we sign at the doctor's office, it is actually a massive, evolving legislative architecture that governs how our most sensitive personal information is handled. And over the next few minutes, I'm going to walk through its origin, its enforcement, how it plays out in recent headlines, and where it is going in the new age of artificial intelligence. So it started in 1996, signed by President Clinton. The Health Insurance Portability and Accountability Act, or HIPAA, wasn't originally the privacy law we know today. Back then, the primary goal was economic. It was designed to ensure that if you changed jobs, you wouldn't lose your health insurance. It was about portability. But tucked inside this law was a mandate to simplify administrative costs by digitizing claims. So Congress realized that if we were going to digitize health data, we better have a plan to protect it. And to understand the law's scope, we look at its two main pillars. Title 1 focused on that insurance portability, so protecting workers, and Title 2 is where our focus mostly lies today, and this is the accountability section. It mandated national standards for electronic healthcare transactions. This is the section that gave birth to the privacy and security rules that organizations follow today. So this leads us to the privacy rule implemented in April of 2003. And this rule answers the question, who and what does the law govern? So it governs covered entities, and this includes three specific groups. So we have the healthcare providers, such as doctors and clinics, health plans, such as your insurers and HMOs, and healthcare clearinghouses, which are the middlemen who process billing data. So it regulates specific records management activities, specifically the use and disclosure of protected health information, also known as PHI. This includes anything that can identify a patient. So that is our names, birth dates, social security numbers, whether it is on a piece of paper or spoken in a conversation. It gives patients the right to see their own records and demand corrections. So while the privacy rule protects the what, the security rule protects the how. So this rule applies specifically to electronic PHI, and it mandates that organizations implement administrative, physical, and technical safeguards. So this is why our doctors need a password to access their computer and why their server room is locked. It operationalizes the CIA triad, maintaining the confidentiality, integrity, and availability of digital records. And in 2009, the landscape shifted again with the HITECH Act. As part of the economic stimulus, the government paid doctors to switch from paper to electronic health records, also known as EHRs. So this explosion of digital media created new risks. So HITECH tightened the screws, increasing the penalties, and crucially extending HIPAA rules to business associates. So now it wasn't just the doctors liable, it was the IT company hosting the doctor's email server as well. HITECH also introduced the breach notification rule, and this is the shame aspect of enforcement. So if a data breach affects more than 500 people, it is not a secret. So the organization must notify the victims, the HHS secretary, and the media. And this public reporting requirement is a powerful motivator for organizations to keep their cybersecurity tight. And then in 2013, the Omnibus Rule finally finalized these changes. So it permanently integrated business associates into the chain of liability. So it essentially closed the loopholes that third-party vendors have been operating in, ensuring that anyone touching patient data was on the hook for protecting it. Now, let's look at how the law functions in the real world today by examining three powerful examples where HIPAA intersects with policy and social justice. So, when looking at bias in digital records, this is where the law runs into a significant problem. HIPAA excels at protecting the security of a record, but it utterly fails to protect the truth of that record. And studies have exposed deep concerning documentation bias. So, with Mary Catherine Beach et al., found that clinicians often documented the pain of Black patients with sickle cell disease in ways that subtly undermine their credibility, casting doubt on patient reports of severe pain. And even more troubling, research by Sun et al. Found that Black patients had 2.54 times the odds of having negative descriptors like aggressive, angry, or non-compliant written in their medical notes compared to white patients. So why this inherent inaccuracy is so damaging, even under HIPAA protection, because these digital records are foundation of all future care. So these stigmatizing labels are permanently embedded in the EHR, leading to poor clinical decisions as future providers influenced by these negative descriptors may misinterpret symptoms, delay diagnosis, or offer inadequate treatment or perpetuation of health disparities. So, for marginalized groups, these inaccuracies reinforce systemic inequality, directly undermining the quality of care and eroding patient trust. So, the core challenge is basically this: if the digital record is inherently biased or inaccurate, protecting it only preserves the injustice embedded within the data, making the HIPAA shield useless in achieving true patient well-being. And then lastly, we recently saw with the Biden administration in 2024 that HIPAA adapted for a post-Roe world, where the Biden administration introduced new rules specifically to protect the privacy of patients seeking abortions and the workers providing them. So, as noted in reporting by Diamond and Rubin, this was a direct response to prosecutors attempting to access medical records for legal crackdowns, and here HIPAA is being used as a shield to safeguard reproductive autonomy. So this leads us to our current landscape, and we have some challenges such as cybersecurity threats. So ransomware attackers specifically target hospitals because they know the data is critical. And compliance is no longer just about paperwork, it's about preventing the hospital from shutting down. And an example of this is the Anthem breach, which remains one of the largest and most expensive in healthcare history, highlighting the severe financial risk of failing to implement adequate security safeguards. So, Anthem, the second largest health insurer, was breached, compromising the records of nearly 79 million patients. And the company settled the resulting lawsuit for $115 million. And this massive figure, combined with a separate multi-million-dollar fine from the OCR, set a precedent for the financial accountability of covered entities under HIPAA. And when looking at the opportunity, we are trying to move from just looking data down to safely sharing it so that your specialist can talk to your primary care doctor seamlessly. And also AI and innovation, so just leveraging de-identified data for machine learning and precision medicine, turning vast compliance archives into engines for medical discovery. So, what are the prospects of HIPAA? Frankly, the law is showing its age. It needs to evolve from an entity-based model to a data-based model. So currently, HIPAA does not cover your Fitbit or a period tracking app, but those app developers aren't doctors, so this is where we have the app gap. Furthermore, as we kind of wrestle with artificial intelligence, the law must change, so we must expect future policies to dictate how PHI can be used to train AI models. We need regulations that prevent algorithms from learning the biases we just discussed. So the future of HIPAA isn't just about privacy, it's about that algorithmic governance. And then when thinking about questions for future research, one that comes to mind is, can we ensure that AI-driven data analysis is accurate and fair? So how do we empower patients to correct subjective errors in their charts? And how do we bridge the gap between privacy, such as keeping a secret, and integrity, which is telling the truth? And we know that HIPAA has served us for nearly 30 years, but to survive the next 30 years, it must adapt to a world where data is everywhere and accuracy is just as important as secrecy. And here are my references, and thanks for listening.